amendments were designed to address the situation of mandatory retirement for critical health professionals in the public health system. These are senior decision makers in our system who are forced to retire due to their age and for no other reason. As Professor Crown said during the 2015 debate, we are not so flush with trained, experienced staff that we can afford to offload them voluntarily. The Longer Healthy Living Bill, as it was called in 2015, got cross-party support. And in the Oireachtas, at that time, the Committee on Justice, Defence and Equality examined in detail the broader issue of mandatory retirement in the context of the Employment Equality Abolition of Mandatory Retirement Age Bill, which was put forward by Labour Party TD Anne Ferris. And in that context, one of the submissions was by Dr. Enda Shanahan, who helped me formulate some of these amendments. And if I may quote from his contribution to that committee, he said, 2 years ago I was compelled to retire from the health service where I worked as a specialist hospital doctor. I wrote to management, Minister Howlin and Minister O'Reilly, indicating that I was able and willing to keep working in the public health sector after the age of 65. I explained that I was physically fit, still running all distances up to and including marathons, and medically fit for purpose, as certified for the Medical Council Continuous Professional Development Process. The answer was that retirement was mandatory on reaching the age of 65. At no point was any objective effort made to assess my suitability to continue working. I was retired purely because of a date in the calendar. The health service, as you know, Cathaoirleach, is on life support. It is in dire need of resuscitation and reform. As a doctor and a senator who is trying to be constructive, pragmatic and solution-driven, I'm bitterly disappointed that these amendments are ruled out of order on a technicality. These amendments would have helped in a small way to ameliorate the staff shortages that plague our health system.
Dermot Wilson.
First of all, thank you, Last Cathaoirleach. I'd like to welcome Minister Cochrane Kennedy back to the House and to compliment my colleague, Senator Swanwick, on putting down these amendments, these very worthwhile amendments. While I remember well Professor Crown, when he was a colleague of ours in this House, bringing forward legislation in this regard. And at that time, it was well received, but nothing was done about it.
I want to support what Senator Swanwick and Wilson are trying to achieve here. I believe very strongly, apart from the fact that we have a consultant shortage, apart from the fact that we have difficulty filling posts, there's a much broader issue at play here. There's the issue of ageism. The bottom line here is performance of one's duty and one's suitability to perform those duties should be based on competence, not age. Everybody is living longer, thankfully. Well, not everybody, obviously, but as a group, humanity is living longer. People are healthy. We have already had statements at the Global Economic Forum which points out that we have this host of individuals aged between 65 and 80 who are healthy, wealthy and looking for something to do as an opportunity for tourism in this country. So I fully support the concept that somebody should be adjudicated upon in terms of their ability to carry out their job on competence, not age. And just to supplement the point very briefly, currently now with the new under-6s contract, GPs can work to 72 years of age if they wish. So I'm not suggesting for a moment that people should be forced to work beyond 65 if that's not their desire, but they certainly shouldn't be prevented from doing so when they have an expertise built up over many years, which is very hard to replace.
Okay, I'm going to be really brief. Broadly support your amendment, Senator Swanwick, and happy to outline my support for it very briefly. We have a serious problem attracting health professionals, and I will be talking obviously on behalf of my nursing colleagues, thousands of vacancies and other healthcare staff workers, and trying to bridge the gap of expertise and mentoring of the new recruits that come in. We've lost a lot of that in our time. I think this measure does enough to safeguard the employer and the employee and ensure fair fairness and choice. And it is about choice. I don't want to see it as mandatory. Some of us are just kind of... We've had our day in our Zimmer frame earlier than we expect because we've been worked so hard, I suppose. We're all living longer and subsequently promoting lifelong learning, and this is a part of it.
I just want to support Dr. Swanwick's amendment, even though it was ruled out of order, because I think it's excellent. And in fact, Senator Crown spoke about it in the last Senate, and that why on a certain date when one is 65, if one is, as Dr. Riley said, experienced, knowledgeable, resilient, full of health and competence, that one has to give up one's job. Now, you can rule it out of order all you like, and it was ruled out of order on financial grounds, if I'm correct. Is that right? Financial burdens on the state.
Sorry, relevance apparently as well. But that's something, a matter you'd have to pursue with the Cahill.
Well, it is the most relevant, it's one of the most relevant amendments here, because if you look at the financial burden or the emotional trauma that has happened to people on waiting lists, the cost to the state, but the cost to the people is unmanageable. I really think his amendment is ageist. I mean, ruling it out of order is ageist. I mean, 25% of us are going to be over 65 in 2020. What are we thinking about? It is outrageous. I think it's one of the best and most creative amendments that has come in here, and the idea that he would rule out of order, I would like to know why and on what grounds.
But you'll have to pursue that with the Chair. I'm sure you'll be able to have a discussion with him yourself.
Yeah, well, that's all very well, but I would like to support you.
Well, I understand.
I think it's an excellent. I think we are insane.
It was explained, Senator, to the member who tabled it. That's what I understand.
I'd just like to support you, Dr. Swanwick. I think it's an excellent, and I think you should pursue it. Against all odds, pursue it. And maybe the Senate could actually bring it about, that people don't have to leave their work, be they competent, able, resilient, terrific, and with all of that experience, and have to leave their work on a certain day when they're 65. I never heard anything as ridiculous.
Thank you, Senator.
If they want to stay.
Senator Rose Conway-Walsh.
Thank you, Cahill. Look, I too would like to support that amendment on the basis that I think it's just hiding behind a cloak of, there may be some financial liability in the future without quantifying that in any way, shape or form